Okay, everyone, welcome to Education for New Moms regarding healthcare facilities. I'm Tiaja, and I'm going to be our moderator for tonight, and I'm the lead family resource navigator here at the Center for African American Health. Just to clear up a few housekeeping items, in this webinar, you are going to be muted and you will only be able to see myself and the presenter along with her slides. Um, and you can find the chat box down at the bottom of your Zoom screen. You can select all panelists if you are having any technical issues, and you can also chat to everyone in the group. Just keep in mind that our presenter cannot see your smiling faces, so really try and interact and ask questions in the box as questions arise. And just throughout our presentation, if you do have any questions, just keep in mind that we are going to hold those until the end, and then Janae will go ahead and address those. And then just so you all know a little bit about Janae, she is a medical assistant. She is a certified nursing assistant as well as a phlebotomist, and she has over 10 years of experience in healthcare and, excuse me, in healthcare, ranging from working in emergency departments, inpatient care hospitals, as well as specialty clinics. And as a Colorado Council of Black Nurses Inc. scholar, she's pursuing an NIH grant to continue to educate mothers to seek the appropriate healthcare facilities for themselves and for their families. And as a mother of four, she definitely would have appreciated this information when she was having her children. And her passion in healthcare is really just to be able to educate individuals on the way to obtain their healthcare degrees and educate patients on what would be their best fit circumstances in healthcare. So without any further ado, I'm going to go ahead and hand it over to Janae.
Thank you, Tiaja. Bear with me. All right. Hello, and thank you everyone for taking the time out of your day to learn about what healthcare facility to take your child to so they can receive the best and appropriate treatment at any given time. We'll start off by having you guys take a pre-survey, and I will go ahead and give you guys about 3 to 5 minutes or so to go ahead and do that. There's only 10 questions, so there's not too many. And I'll give you guys one more minute to wrap that up, and we'll go ahead and start the presentation. Okay. Alrighty. So why did I choose this project? I started this project when I used to work in an emergency department and heard a rumor that Medicaid was going to stop covering ER visits. Seeing the number of families that came in on a daily basis to get care for their child and often their whole family, I thought about how many families would suffer if this happened. How could an insurance company determine what is an emergency and what is not? Turns out Medicaid was just going to start charging copays, which is still an added expense to families who cannot afford insurance in the first place. What could I do about it? As a mom, I know that moms usually make the decision to take their children to the emergency department, usually because they wait to see if there's truly a concern for their child's health. But new moms who do not know what is within the norm tend to think most everything is an emergency when it comes to their child. I realized educating new moms on which facilities will help moms make an informed decision on where to get the best treatment for their family will also help families avoid having to come out of pocket on unnecessary copays and expenses. This gives me a centered audience because it'd be really hard to teach everybody. So this is good information for everyone, but this would give a center audience where it can hopefully get to everyone. They would be the ones to teach their children. They would teach their parents, and it would just get carried down from there. They would be the center focus. So now that you know why I started this project, let's talk about why emergency departments, and let's talk about emergency departments and why the emergency department is used for non-emergent healthcare concerns. We're going to talk about the most visited facilities, primary care, urgent cares, and emergency departments. So primary care clinics should be your long-term follow-up care. It should be the facility that you go to no matter what you need. And they would be the facility that would refer you to a specialty physician like a cardiac physician, cancer oncologist, or a gastroenterologist if needed. A lot of patients do not see a primary care physician because they do not have one, due to many reasons, whether it's because they cannot find one that will take their type of insurance, the office is never opened or available when the patient needs to be seen, or you just can't afford to pay the copay at time of service. Because there are so many that do not have primary care physicians, many patients are unable to see a specialist because clinics or insurances require referral. With that said, many result to the use of emergency departments for treatment. Then we'll go ahead and discuss the urgent cares. The biggest question that most ask about in urgent care is, what is an urgent care? An urgent care's purpose is to treat patients who have non-emergent healthcare concerns. So if it's not deemed life-threatening, going to urgent care could probably be more beneficial. What is nice about an urgent care is that they have weekend hours and generally are open earlier and later than most primary care clinics. Some now even have mobiles that they will drive to your home to do an assessment. Many do not use these services because as a patient or parent, how do you know if it is considered life-threatening or not? Then there are a few times when you go to an urgent care and the facility transfers you to the emergency department because your health care concerns requires more resources than an urgent care can provide, double billing. So then that brings me to, what's the copay? How much does it cost? It generally would cost more at time of service than it would if you were seen in a primary care clinic. But regardless of how much your primary care clinic would cost and the urgent care would cost at time of service, is usually way less than your bill for the emergency department would have been. Now that leads us to talk about emergency departments. Why is emergency departments so commonly used for non-emergent healthcare concerns? Well, they're always open. Most believe that physicians at these facilities are the only physicians that can handle all types of healthcare concerns. Plus, they must treat you regardless of pay at time of service. But that's just it. The purpose of an emergency department is to treat and help a patient become stable so they can either move on to be seen by their primary care physician, usually in a few days, or be admitted to the hospital for further treatment. Emergency departments are not meant or designed for follow-up care. Even though you do not have to pay at time of service, what about the bill you receive in the mail after treatment? Was it really worth it? Even though there are a lot of reasons why a patient or parent would want to be seen in the emergency department, the downfall is that emergency rooms are starting to become overcrowded and with non-emergent patients, and patients are receiving bills that they are struggling to pay. All physicians have done rotations and they could treat any condition, but emergency physicians' main specialty are life-threatening conditions. This is what they are known for and what they do best. So, after listening to the first half of this presentation, my question for you is, what is your first choice in healthcare? You guys are welcome to answer that question in the chat, and I will go ahead and give you guys about a minute or so. Okay. Oh, did it fast forward? Uh-oh. There we go. Okay. Thank you, everyone, for your response. So, why not go to the best? Healthcare facilities provide care to all, but what most do not know is how healthcare facilities specialize in particular fields. Here are a few examples of those specialty fields. There are emergency departments, pediatric emergency departments, urgent cares, specialty cares, and primary cares. Primary care physicians are just as good as an emergency room physician would be in their specialty. A primary care physician could catch an illness that emergency department physician may not be able to puzzle together. How? Simply because they have seen these illnesses on a consistent basis. Some illnesses are more common in a primary care clinic than it would be in an emergency department. This goes for all clinics and hospitals. Each healthcare provider has training that focuses on the specialty, and a lot of times that means that they are the experts. A prime example would be pediatric emergency departments versus adult emergency departments, who are both educated and can treat both children and adults. In the article, Adult Patient Visits to Children's Hospital Emergency, it stated that it is essential that physicians staffing children's hospital emergency departments be properly trained in stabilization of common adult medical emergencies. So even though adults are frequently seen in children's hospital emergency departments, children are seen comparably in an adult emergency department. This article also stated that the resources available in a pediatric emergency room are another important component in terms of the equipment used and the availability of highly specialized physician partnerships. So these differences between a children's emergency room and an adult emergency room are something that every parent should know. Other specialties have the training and knowledge, but they may not have the expertise. Many are under the belief that having training and knowledge is good enough, which could be the case. But some physicians may not be as prepared as you would like them or even expect them to be. So with all that being said, what I'm getting at is what you see the most is what you know the best. So why is seeing the best beneficial? These highly specialized physicians can make a significant difference in delayed care before and after approaching the hospital. How? For one, emergency departments would then be able to stabilize patients to be seen by an in-house specialist instead of care being delayed so that patients could be transferred to an appropriate healthcare facility. Also, the necessary equipment is available and the majority of staff would have consistent knowledge of those materials. This would decrease unnecessary hospital visits and costs for patients. It will also allow physicians to make decisions based on their expertise. Lastly, patients and families can make better decisions on where they receive their health care and become better informed why those decisions are beneficial. So with that said, thank you everyone. I do have this is the end of the presentation. If you have any questions, Tiaja will go ahead and let me know what they are or how to find them. And otherwise, there's a short post survey that I would appreciate everyone to fill out. And I appreciate you guys attending my presentation.
Okay, so I will go ahead and give everyone some time to go ahead and answer the post-survey questions. Janae, do you think a minute or so is fine?
Yeah, that would be
Okay,
perfect.
so I'll
Just
let
not
everyone
as long as the other one.
Okay, so I'll let everyone have a minute or so to go ahead and complete these post-survey questions. And then I did see some responses to her questions about which option would you choose come in through the Q&A. So I'll read those responses off. And then if you do have some questions, go ahead and send those through the Q&A as well. That way Janae can answer those live for you all.
All righty, Tiaja.
Okay, perfect. So I'm going to go ahead and just share the responses that came in. So Robert responded saying he would have chose a primary care doctor. Rose said that, it really just depends on the situation. I know kids can break a bone and most parents would want to send them to the ER. And then the last one would have chose a primary care physician. So I just
Okay,
wanted to share those
good to know.
responses with you. And then, all right, so the first question that has come in, do emergency rooms tend to charge more than other facilities all the time or just sometimes?
From my experience in working in an emergency room, the majority of the time. That would be my reply for you. A lot of it is because how you come in and present it. So for example, if your ribs hurt, but it feels like you have chest pain, they're going to treat it as a cardiac issue. And automatically you would get charged more because they have to do a full workup. Things like that, where, but from my understanding is going to a primary, even for something simple as a fracture, or, where they can do an outside radiology image, or going to urgent care, they'll probably charge less than if you went to the ER and they gave these full services and certain medications and things like that. You would get charged for each individual item.
Okay.
Was there any other questions?
If anyone has any other questions, we have about 9 minutes, so definitely feel free to send the questions over. While we're just waiting for some of those additional questions to come through, I just want to remind everyone that if you did enjoy Janae's session, please be sure to use the like session button on the Whova web platform, or you can use the 3 stars rating, in, which is the button on the phone app if you're joining us from your phone app as well. All right, so does anyone have any other final questions before we begin to wrap up the session? Or Janae, if you have any final thoughts that you'd like to add, you can do so as well. Oh, okay, got a question. How do we know which type of medical facility we should go to? Is it symptom-based or does it really even matter?
So that would be another portion of my project where usually start off with it would start off with the importance of having a primary care physician, because that would be the person you would call, you would provide them the symptoms, and they would be the best person to advise where you should go from there. If you don't have a primary care physician, the best route would be to judge it. Do you feel like it's life-threatening? If it's life-threatening, go to an ER. If it's something that you think can't wait till tomorrow, but not quite life-threatening, go to an urgent care. If it's something you think that could wait till the next day, go to a primary. That's kind of a guideline that I would follow. It's kind of what I've been told by other physicians that they feel work best. But yeah, that would be my suggestion in that.
Okay, Janae, do you have any final thoughts? I believe that those are all our questions.
I do not. Thank you everyone for participating.
Oh, I got another question actually.
Oh,
Um,
okay.
so based on your presentation, each facility bills differently. Am I correct, or did I misunderstand that?
Yes, each facility bills differently, and with your insurance, based off what type of insurance you have, you may also have different copays. I hope I answered everybody's question. Okay.
How does someone know if they are billed correctly or not?
That I do not know. I'm sorry. I can't provide you guys an answer with that one. It's more, I would suggest just looking over how they build you and whether or not those are the type of services you received. And then if so, just to review with your insurance company if what they would pay for and what they would not pay for type of thing. But that would be the best that I could answer that question.
What if I don't have any money, but my kid is hurt? Should I still consider going to an emergency room?
That's a little bit more on medical advice. It's something I can't quite exactly give. If you don't have money, where you should go. I mean, it also based off of, do you have money and do you not have money, but you have insurance? The facilities from this presentation, it's more about the facilities and what the appropriate facility is for what type of situation. So if it's for your kid, pediatrics is best. And it's, whether it's a pediatric primary. So that's more what this presentation is about than about insurance and if you can afford it or not. That comes with, if you're choosing the appropriate facility, you get appropriate care, and you would get care that would match the type of symptoms that are being presented.
If they were to itemize the things I used, such as a scalpel, should I request that I receive that I said scalpel?
Sorry, I don't understand your question.
Let me just make sure I'm reading this right. Okay, so if they were to itemize things that I use, such as a scalpel, should I request that I received that said scalpel? So I think what the question is asking is if they itemize the items that were utilized during their service, if they are contacting their insurance, it sounds like is that the information they should be giving the insurance company? I could be wrong. So if this is your question, feel free to clarify that a little bit more in detail for us. And I think we might have the option to go ahead and unmute people. So
yeah, if they want to say it.
yep. Okay. So this is in relation to billing. So if they receive an itemized bill with the items that were utilized, should they be asking that in a sense of billing?
It would show up on, like, it wouldn't exactly say scalpel, but it would show up as, like, if they gave you a medication, it would say you received an oral medication or a medication through IV. And then you can go through that with your insurance about how that's billed. Does that answer your question?
So if we know we didn't receive it, then we should basically fight it.
Yeah, I've actually seen people do that.
And that did answer her question. So thank you.
Oh, okay. Awesome.
And then if you would like to be unmuted, please just click the raise your hand button and we can go ahead and mute you if you feel more comfortable asking your question that way as well.
Hi, Janaye, can you hear me?
Yes.
This is Cousin Ida, and I just want to tell you you're doing a fabulous job.
Thank you, Cousin Ida.
That's all.
All right, we have about 1 minute left. So does anyone have any final questions before we wrap up the session? Okay, one last question. Wasn't there legislation stating that hospitals must now show cost before being treated?
So there's a new legislation that is read at the beginning of your visit. Legally, emergency departments are not allowed to tell you how much you owe before you have been seen by a physician. You must see the doctor first before we can even give you an estimate of what your hospital bill is going to consist of. And usually it isn't even based on what your hospital bills consist of. It's an estimate of what they want you to pay then and there based off of the information that your insurance company uploaded in a database. The new legislation is more for letting you know that the facility you're in is an emergency department, and that you will be charged emergency department charges. But it doesn't clarify what your cost is going to be before you see the doctor. You won't know that then. They can't legally ask you for money before a physician comes in and looks at you. Did that answer that question? I think it did.
Okay, perfect. So we are over on time, everyone. So we are going to wrap up this session. But just as a final reminder, again, if you did enjoy Janaye's session, please just be sure to use the like session button if you're on the web platform, or if you're on the Whova app, you can go ahead and use the 3-star rate button. And I hope that everyone enjoyed this session. Janaye did great.
Thank you. Thank you, everyone.